Why don't I check progesterone levels in your blood? I got asked this question a few times this week, so I thought I'd explain it here. So the only time I'm really going to check a progesterone level is if we are trying to confirm ovulation. So if you're having regular cycles and we do a day 21 or a week before your period, I can confirm if you've ovulated or not. Progesterone only is released post-ovulation, and it's up and then it's down before your period. And for the rest of the time, it's essentially undetectable. And even if you're having regular cycles, but you're having symptoms of low progesterone, whether that be anxiety, irritability, headaches, and insomnia, those things, that level that we get, maybe it could be a little lower before, but it's also the decline that you're susceptible to, and there's other factors. So I don't need that to recommend progesterone that couple weeks before your period and see if that helps your symptoms or not. And then once you're perimenopausal or menopausal, we don't check those levels because progesterone supplementation is a standardized dose. It's 100 or 200 milligrams. That's what in research has been shown to provide endometrial protection along with an estrogen medication. And when you take that at bedtime, it peaks at night, and then by the morning, it's gone. Every once in a while, I've accidentally gotten a progesterone level because it was checked off, and the level will be sometimes undetectable, sometimes it'll be 4 or 5, and okay, there's no level we're shooting for in the blood. As long as you're taking your 100 milligrams or 200 milligrams along with your estrogen, and you're not having spotting or any bleeding or any abnormal periods, then that's fine. I don't need to monitor that level. And it's more symptom based and making sure that we're providing the endometrial protection. And then for estrogen, I've talked about this before, is that's mostly symptom based, but sometimes we do have some labs that we like your estrogen to be in, to make sure you're getting into your system, and it can help me guide treatment with your estrogen levels. But that's what this video is about. But as far as progesterone, I get this asked every once in a while, what level should we be shooting for progesterone? None. We don't check it.